All right, today we're diving deep into a condition that can be really complex and honestly pretty misunderstood: pulmonary hypertension. We're going to break down what it is, how doctors figure it out, and this is the most important part: why just getting the diagnosis is only the first step in a much bigger medical detective story. So let's jump right in.
So, it often kicks off with a feeling a lot of us might just brush off, right? You're feeling winded, short of breath, especially when you're moving around, and you can't quite figure out why. Well, that's often the very first subtle clue that brings someone into a doctor's office. It's that little hint that pressure might be building up somewhere it really shouldn't be.
So, what are we actually talking about here? Let's use an analogy. Think of your entire circulatory system like a plumbing network. Your heart, that's the main pump, and the pulmonary arteries are these super important pipes that go to your lungs. With pulmonary hypertension, those pipes start to get narrow, or sometimes even blocked. This creates a really dangerous pressure backup, which means the right side of your heart, the part that does all the work pumping blood to the lungs, is suddenly under an incredible amount of strain. Now, to make things official, doctors need a specific number. There's a magic number here, and it's 25. The key diagnostic line is a mean pulmonary artery pressure over 25 millimeters of mercury when you're at rest. Once you cross that line, boom, the pressure in those pipes leading to your lungs is officially and dangerously high.
Okay, and this is where things get super interesting. This high pressure isn't just one single disease. It's actually more like a finding, a signpost that points to a bunch of different potential root problems. And these problems are all organized into 5 distinct groups.
And this is maybe the most crucial thing to understand. A diagnosis of pulmonary hypertension isn't the end of the story. It's the start of the investigation. The high pressure itself is just the symptom. It's the big red flag. The real detective work is figuring out why. Why is that pressure so high in the first place? So let's look at our 5 main suspects. In Group I, the problem is actually in the lung arteries themselves. For Group 2, it's basically a traffic jam backing up from a failing left side of the heart. Group 3 is all about chronic lung diseases like COPD. Group 4, that's caused by old blood clots gumming up the works. And Group 5 is kind of a catch-all for a bunch of other causes. So the entire goal of the diagnosis is to figure out, okay, which one of these buckets does this patient fit into? So how do doctors actually do that? How do they go from that general symptom to pinpointing a specific group? Well, that brings us to the diagnostic toolkit. It's a step-by-step process they use to investigate. First things first, doctors need to figure out how severe it is, based on how much it's impacting your daily life. This is called the WHO functional classification. It goes from class 1, where you don't really have any limitations, all the way to class 4, where, man, you can have symptoms just sitting still on the couch. This gives them a quick sense of just how serious things are right off the bat.
Next up, it's time to get some pictures. These are the initial non-invasive screening tests. An echocardiogram, which is basically just an ultrasound of the heart, is a huge first step. It can show those early signs of strain on the right side of the heart. And then other tests like a CT scan, an X-ray, and an ECG help gather even more clues and rule out other potential issues.
But here's the thing, all those tests, they give really strong hints, but they can't provide the final definitive answer. For that, doctors have to turn to what's considered the absolute gold standard for confirming the diagnosis and getting those precise pressure numbers. And that test is the right heart catheterization. Now, it is a more invasive procedure. A doctor guides a very thin, flexible tube right into the heart and into the pulmonary artery to measure the pressures directly at the source. It is literally the only way to get that definitive number and to truly understand what's happening on the inside. And the information from this one test is what really cracks the case wide open. A key measurement they look at is called the pulmonary capillary wedge pressure, or PCWP. The easiest way to think about it is that it's measuring the traffic after the lungs. If that pressure is low, it tells you the problem, the roadblock, is inside the lung arteries themselves. That's Group I. But if that pressure is high, that means there's a huge traffic jam backing up from the left side of the heart, and that points you straight to Group 2. Making this one distinction is absolutely fundamental. Why? Because once you know the group, then you can finally target the treatment. This is not a one-size-fits-all condition. Not at all. The therapy has to match the underlying cause, otherwise it just won't work. And you can see how the treatment plan just clicks right into place. For Group 2, you treat the left heart failure. Makes sense, right? For Group 3, you manage the lung disease. Group 4, you go after the blood clots. But for Group 1, where the problem is the arteries themselves, the whole approach is completely different. The therapy has to go after those blood vessels in the lungs directly. For that specific group, the main goal is something called vasodilation. It's a fancy word, but all it means is using specialized medicines to get those constricted, tight pulmonary arteries to relax and open up. That brings the pressure down and gives the heart a much-needed break. And to do this, doctors have a whole arsenal of powerful drugs. They work on different biological pathways to encourage those vessels to chill out. You've got drug classes like prostacyclins, PDE inhibitors, you might recognize one of those, sildenafil, and another group called endothelin receptor antagonists. A huge part of the treatment is figuring out the right drug or even the right combination of drugs for each person. The approach also escalates based on how severe things are. For patients in class 2 or 3, treatment usually starts with oral medications, pills. If symptoms don't get better, they might combine different drugs. And for the most severe cases, class 4, patients might need continuous medication that's delivered 24/7 through an IV or a little pump under the skin. So, we've gone through a lot here. The definition, the causes, the diagnosis, the treatments. If there's one single thing you remember from this entire explainer, what should it be? It all comes down to this. High pressure in the pulmonary artery is a serious, serious warning sign. But it's not the full story, it's a symptom. The most critical question in managing this condition will always be, what is the underlying cause? Because finding that answer, that is the absolute key to getting the right treatment and having the best possible outcome.